So how do we treat, how do we operate these patients? So first of all, it's important to select good surgical candidates. So for that, we consider the functional status, their status of systemic disease, and their expected survival. And as mentioned before, those with poor functional status and short expected survival and uncontrolled systemic disease are less likely to be offered surgical treatment of their brain metastasis. It's not to say that it will not be treated, so it can be treated with other less invasive therapies such as radiation therapy, which has much lower upfront complication risk. And then when we speak about surgery, we speak about different surgical approaches. So ideally for brain metastasis, we perform gross total resection, and that can be feasible for brain metastasis, treating the lesion that we see because of a typically clearer margin between tumor and normal brain tissue as compared to other intrinsic brain tumors such as gliomas. So margin is better, and we can achieve gross total resection in majority of brain metastasis patients. However, that's not feasible. We can perform subtotal resection, but that's less commonly done in for brain mets. And for lesions that are small, deep, and eloquent, we can perform stereotactic biopsy or using image-guided biopsy. So to be precise, just sample a small tissue and to make a diagnosis. That's typically offered for patients who don't have a cancer diagnosis on hand, or they have a comorbid cancer diagnosis and it's not clear which one spread to the brain, and their treatment options are completely different. So main benefits of neurosurgery is histological diagnosis, symptom relief, and improved survival. And the risk, again, it depends, but it's really it's less than 10% of major complications of surgical resection, and that can include neurological worsening, infection, stroke, and then hemorrhage. Now, quality of surgery is improving in years, so in particular, improvement of surgical planning approaches, and so we routinely use image guidance to guide us to brain lesions and to brain metastasis, and to kind of go on target and not to wander in the brain.